The CDC says 3 of the 4 largest counties in North Texas are now high risk for COVID. Cases have been ticking up for a few weeks now, driven by a highly transmissible subvariant. At least one forecast warns that hospitals may start getting too crowded by next month. Fox 4's Blake Hansen is live with more on what researchers are forecasting for the rest of the summer. Blake.
Yeah, Heather, the highly transmissible BA.5 virus is now dominant here. And while still early, doctors say that past evidence shows acting early goes a long way. The CDC says Dallas, Tarrant, and Collin counties now have a high amount of COVID spreading after a relative lull in this pandemic.
The cases are rising week over week at a higher and higher percentage.
Dr. Mujib Bassett helps oversee COVID forecasting at UT Southwestern. Its projections this week show if nobody changes their behavior, hospitalizations in Dallas County, for example, could rival the Delta wave from last year. Bassett notes it's still early, complicating things the way the virus is mutating, plus people's protection levels from vaccines or past infection.
What's interesting scientifically and really somewhat scary about this virus is it is mutated enough that it can somewhat escape that recognition. And that's why it's spreading. And we've seen some anecdotal evidence that people may have gotten Omicron in January and they're getting BA.5 again now. And that's information that we try to monitor very carefully.
As COVID cases dropped earlier this year, researchers tracking the virus say they've also had a tougher time getting hands on data. At-home tests mean not all cases are reported, and some agencies stopped reporting information.
It was a reasonable request at the time, thinking, COVID is down, we're low. Why are we spending all of this money? Our federal funding and state funding options are drying up. Do we really continue to do this? And I think, BA.5 and BA.4 have reminded us that it's still important to have this early warning framework.
Hospitalizations are starting to rise again. More than 700 patients are hospitalized in North Texas, similar to levels in early March. UT Southwestern noted a concerning trend, a steep rise in patients over 65 who are at risk for more severe disease. But hospitalizations are still far off from the more than 4,000 patients in January.
We're higher than we've been in 4 months, but it's what I would characterize, Blake, as a wave, not a surge, but more of a uptick and a wave.
Officials say getting up to date on vaccines and boosters is key. They can still make an infection far less dangerous.
And I was on a call with the chief medical officers last night. Here's what they say. We know that BA.5 is extremely contagious. So if you're not vaccinated, please get vaccinated. And also, if you're not fully current on your boosters, get current on your boosters.
Healthcare professionals are also recommending that people mask up, especially if they find themselves in a crowded situation. Heather?